Hey guys, welcome back. Today's chapter is Chemical Coordination and Integration, and 25 most important questions will be discussed in this session. If you are a NEET aspirant, subscribe and press the bell icon. Every day I am discussing 25 most important MCQs from each chapter of NEET syllabus. Let's begin with today's session. Here, question number 1. The posterior pituitary is under the direct neural regulation of the dash. Option 1, hypothalamus. Option 2, cerebellum. Option 3, pons. And option 4, medulla oblongata. And here, among the given options, option 1 is the right option. So here the posterior pituitary is under the direct neural regulation of the hypothalamus. Okay, so this one is the right option. Moving to the second question, the dash is located in a bony cavity called sella turcica. So here the first option, thyroid gland, second, thymus gland, third, pituitary gland, and the fourth, pineal gland. And here, among the given options, pituitary gland is the right one. The pituitary gland here, the pituitary gland is located in a bony cavity called sella turcica. It is the bony cavity inside which the pituitary gland is located. Now, moving to the third question, identify the hormone with its correct matching of source and function. So, here the hormone, its source and the function. We have to match these options. Now, oxytocin, here the source is a posterior pituitary and the function growth and maintenance of mammary glands. Second option, melatonin. The source is pineal gland and the function regulates the normal rhythm of sleep-wake cycle. And option 3, progesterone. Source corpus luteum and the function stimulation of growth and activities of female secondary sex organs. And the fourth one, atrial natriuretic factor. Here the source ventricular wall and the function increases the blood pressure. Here we have to find out the correct matching. So here melatonin source is pineal gland and its function is regulates the normal rhythm of sleep-wake cycle. So option 2 is the right one. Now moving to the next question, excess secretion of growth hormone in adults, especially in middle age, can result in severe disfigurement, especially of the face, called, which may lead to the serious complications and premature death if unchecked. And here options are, the first option, Graves' disease, option 2, dwarfism, option 3, gigantism, and option 4, acromegaly. And here the excess secretion of growth hormone in adults, especially in middle age, can result in severe disfigurement, especially of the face, and it is called acromegaly. And the fourth option is the right option. Now moving to the next question, which of the following hormones can play a significant role in osteoporosis? Here option 1, estrogen parathyroid hormone, and option 2, progesterone and aldosterone, option 3, aldosterone and prolactin, option 4, parathyroid hormone and prolactin. And here among the given options, here the first option is the right option. Estrogen and parathyroid hormones can play significant role in osteoporosis. osteoporosis. Okay, and actually parathyroid hormone is increasing, thereby they are increasing, okay, blood calcium levels. Okay, so this is the right option, first option. Now moving to the next question after this, which one of the following hormones, though synthesized elsewhere, is stored and released by the master gland? And here the master gland is pituitary gland. Okay, and here the option is which which one of the following hormones, though synthesized elsewhere, somewhere it is synthesized, but it is stored and released by this pituitary gland. And here the option, first option, MSH, melanocyte stimulating hormone. MSH is nothing but melanocyte stimulating hormone. Okay, so this is wrong. Second is ADH. It stands for anti-diuretic hormone. And the third, luteinizing hormone, and the fourth, prolactin. Here, among the given options, ADH, anti-diuretic hormone, is the right one. Okay, so it is synthesized in hypothalamus, but it is stored and released by the master gland, that is a pituitary gland. So second option is the right one. Now moving to the next question, the pineal gland is located on the option 1, ventral side of midbrain, option 2, dorsal side of hindbrain, option 3, dorsal side of midbrain, option 4, dorsal side of forebrain, and here the fourth option is the right one. The pineal gland is located on the dorsal side of forebrain. Now moving to the next question, question number 8. Both the lobes of thyroid gland are interconnected with a thin flap of dash called isthmus. And here we have to find out, here first option epithelial tissue, the second option connective tissue, the third one muscular tissue, and the fourth option nervous tissue. And here the isthmus is a thin flap of which tissue? Here the option is the second one, that is connective tissue. So isthmus is a thin flap of connective tissue, and it is interconnecting the lobes of thyroid gland. Now moving to the question number 9. Exophthalmic goiter is a form of hyperthyroidism characterized by, here, A, enlargement of the thyroid gland, this is correct. Protrusion of the eyeballs, this is correct. Now the third, increased basal metabolic rate, yes, and weight loss, yes, all these are the characteristics of the disease condition exophthalmic goiter. So here option 4, A, B, C and D, this option is the most appropriate option. Now moving to the next question, that is question number 10. GnRH, this is gonadotropin releasing hormone. RH stand for releasing hormone, is a hypothalamic hormone needed in reproduction, acts on option 1, anterior pituitary gland, and stimulates secretion of LH and oxytocin. LH for luteinizing hormone, and here GnRH stands for gonadotropin releasing hormone. Okay, now here the second option, anterior pituitary gland, and stimulates secretion of luteinizing hormone and follicle stimulating hormone. And the third option, posterior pituitary gland, and stimulates secretion of oxytocin and FSH. The fourth option, posterior pituitary gland, and stimulates secretion of LH and relaxin. And here among the given options, option 2 is the right one. Here, gonadotropin releasing hormone is a hypothalamic hormone and it is needed in reproduction, acts on this GnRH, gonadotropin releasing hormone, gonadotropin releasing hormone. Okay, this hormone acts on anterior pituitary gland and stimulates secretion of LH and FSH. LH for luteinizing hormone and FSH for follicle stimulating hormone. Now, moving to the next question. Here, question number 11. Which of the following statements is correct in relation to the endocrine system? Now, here, option 1, adenohypophysis is under direct neural regulation of the hypothalamus. This is wrong because adenohypophysis is not under the regulation of hypothalamus. This is wrong. And the second option, organs in the body like gastrointestinal tract, heart, kidney and liver do not produce any hormones. This is wrong. Actually, they produce hormones. Okay? So, this is also wrong. Now, moving to the third. Here, non-nutrient chemicals produced by the body in trace amount that act as intercellular messenger are known as hormones. Yes, these hormones are the non-nutrient chemicals and they are produced by the body in trace amounts and they act as intercellular messengers. So, here the third option is the right option. And if we check the fourth one, the releasing and inhibiting hormones are produced by pituitary gland. This is wrong. It should be hypothalamus. Okay. Now, moving to the next question. Parathyroid hormone increases dash levels in the blood. Option 1, magnesium levels. Option 2, copper levels. Option 3, calcium levels. And option 4, iron levels. And here, option 3, calcium levels is the right option. Okay. So, parathyroid hormone PTH increases the levels, calcium levels in the blood. Now, moving to the next question, select the incorrect option regarding the location of thymus gland. Here, option 1, between lungs. Yes, it is between lungs. Behind sternum. Yes, it is located behind the sternum. Now, on the ventral side of the aorta, this is also correct. Okay, and on the dorsal side of forebrain, this is wrong. Okay, so here the incorrect option regarding the location of thymus gland is the fourth one. It is not located on the dorsal side of forebrain. On the dorsal side of forebrain, pineal gland is located. So this is wrong. Now, moving to the next question, under production of hormones by the adrenal cortex alters carbohydrate metabolism, causing acute weakness and fatigue, leading to a disease called. And now, here the underproduction of hormones by the adrenal cortex alters the carbohydrate metabolism, and that is causing this acute weakness and the fatigue. And these are the characteristics of a disease. Option 1, diabetes mellitus. Option 2, Addison's disease. Option 3, Cretinism. And option 4, goiter. Here, option 2, Addison's disease is the correct one. Okay. So, underproduction of hormones by the adrenal cortex can result in a disease called Addison's disease, and the characteristics acute weakness and fatigue. Now, moving to the next question, question number 15. Hypersecretion of growth hormone in adults does not cause further increase in height because, I repeat this question once again. Here, hypersecretion of growth hormone in adults does not cause further increase in height because, option 1, growth hormone becomes inactive in adults. Option 2, epiphyseal plates close after adolescence. Now, third one, bones lose their sensitivity to growth hormone in adults. And option 4, muscle fibers do not grow in size after birth. And here, among these options, option 2 is the right one. Epiphyseal plates close after adolescence. So, further increase in height does not occur. Okay? So, option 2 is the right one. Now, moving to the next question, question number 16. Which of the following is an amino acid derived hormone? Amino acid derived hormone. Option 1, estradiol. Option 2, Addison. Option 3, epinephrine. And option 4, estriol. Here, option 3, epinephrine is the right one. Okay? So, amino acid derived hormone is epinephrine. Okay? Now, moving to the next question. Here, glucocorticoids inhibit. Option 1, gluconeogenesis. Option 2, lipolysis. Option 3, proteolysis. And option 4, cellular uptake and utilization of amino acids. And here, glucocorticoids inhibit cellular uptake and utilization of amino acids. So, the fourth option is the right option. So, glucocorticoids inhibit cellular uptake and utilization of amino acids. Actually, the glucocorticoids stimulate these three. Okay? Glucocorticoids stimulate gluconeogenesis, lipolysis and proteolysis. But it is inhibiting the cellular uptake and utilization of amino acids. Now, moving to the next question after this. There are about 1 to 2 million islets of Langerhans in a normal human pancreas, representing dash of the pancreatic tissue. Now, here these about 1 to 2 million islets of Langerhans present in normal human pancreas, it represents how much percentage of a pancreatic tissue? Option 1, only 1 to 2%. Option 2, only 3 to 4%. And option 3, only 5 to 6%. And option 4, only 7 to 8%. And here the correct option is only 1 to 2%. Here the question and the option. Here there are about 1 to 2 million islets of Langerhans in a normal human pancreas, and these many islets of Langerhans represent only 1 to 2% of the pancreatic tissue. It stimulates the secretion of hydrochloric acid and pepsinogen, but here it is given inhibits, so this one is the incorrect statement. Now, if we check the other options like secretin hormone acts on exocrine pancreas and stimulates secretion of water and bicarbonate ions. This one is the correct. And CCK acts on both pancreas and gallbladder and stimulates the secretion of pancreatic enzymes and bile juice respectively. This is right. This is cholecystokinin hormone. It acts on both pancreas and gallbladder and it stimulates the secretion of pancreatic enzymes as well as the bile juice. And here GIP inhibits gastric secretion and motility. This is the right one. So, here the first option is the incorrect option. Now, moving to the next question. Name a peptide hormone which acts mainly on hepatocytes, adipocytes and enhance cellular glucose uptake and utilization. Here, option 1 insulin, option 2 glucagon, option 3 secretin and option 4 gastrin. And here the right option is insulin. Okay? So, a peptide hormone which acts mainly on hepatocytes, adipocytes and enhance the cellular glucose uptake and utilization. Okay, insulin converts glucose into glycogen, and also it is playing important role in cellular glucose uptake and utilization. So option 1 is the right. Now moving to the next question, question number 21. Which hormones do stimulate the production of pancreatic juice and bicarbonate ions? And here option 1, angiotensin and epinephrine. Option 2, gastrin and insulin. Option 3, cholecystokinin and secretin. Option 4, insulin and glucagon. And here the right option is the third one. Hormones that stimulate the production of pancreatic juice and bicarbonate are cholecystokinin and secretin. Okay. Now moving to the next question. Which of the given hormone is not a steroid hormone? Not a steroid hormone. Option 1, cortisol. Option 2, estradiol. Option 3, progesterone. Option 4, epinephrine. And here epinephrine is the right option. It is not a steroid. These three are steroid hormones. Okay. Here cortisol, estradiol and progesterone. All these three are steroid hormones. Epinephrine is amino acid hormone. Okay. Now moving to the next question. Select the incorrect match. And here option 1, peptide polypeptide hormones. Example, pituitary hormones. This is the correct one. Okay, pituitary hormones are mostly peptide or polypeptide hormones. Okay. Now steroids, cortisol. This is a cortisol is a steroid hormone. It is correct. Iodothyronines. These are thyroid hormones. Already a hint is given. Thyronine, thyroid hormone. It is correct. Amino acid derivatives. Insulin is wrong. Okay. So this is incorrect. The fourth option is incorrect. Now moving to the next question. Which one of the following pairs of hormones are the examples of those that can easily pass through the cell membrane of the target cell and bind to a receptor inside it? So here we have to find out the examples of the hormones, the pair of hormones, okay, that can easily pass through the cell membrane of the target cell and bind to receptor inside it. And here option 1, insulin and glucagon. Option 2, thyroxine and insulin. Option 3, somatostatin and oxytocin. And option 4, cortisol and testosterone. And here fourth option is the right one. So cortisol and testosterone is a pair of hormones. Okay, they can pass easily through the cell membranes of the target cell and bind to receptor inside it. Okay, mostly inside nucleus. Mostly inside nucleus. Okay. Now moving to the next question, that is question number 25, and this is the last question. Okay. The posterior pituitary gland is not a true endocrine gland because, I repeat this question once again, the posterior pituitary gland is not a true endocrine gland because option 1, it is provided with a duct. Option 2, it only stores and releases hormones. Option 3, it is under the regulation of hypothalamus. Option 4, it secretes enzymes. And here option 2 is the right one. Okay. The posterior pituitary gland is not a true endocrine gland because it only stores and releases hormones like antidiuretic hormone. Okay. So here option 2 is the right option. Okay. So this is all about today's session. If you are a NEET aspirant, subscribe to my channel because every day I am discussing 25 most important questions from each chapter of the NEET syllabus till the NEET exam.